Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callendar.
Okay. This is an article about a COVID test that gives false results, false positives and negatives. And this, of course, is dangerous. You don't want to be given a negative test when you're positive, because if you're positive, then you need to isolate, quarantine yourself, because you're transmitting the virus. So it's important to have a test that is accurate. And as we know, the one that they did in the Congress of the United States had some false positives, which people thought they were positive. Turns out they weren't. So this is something that we need to eliminate. And so that was the FDA indicating that some of the tests that they had approved did have false positives. Actually, all of them have some false positives, false negatives, just that some of them had more than the others. Usually the false positive rate is in the vicinity of 20% or less. And but that's pretty high for some. And they did not identify the testing company that was responsible for it. But anyway, they did notify Capital, because that's where they had the false positive test.
Well, they said that the company was Curative Inc.
What is that?
That's the name of the company that developed this test that they're using on Capitol Hill.
Yeah, okay. Yeah, it's interesting how these things occur. He said he had no medical background, but you don't need to have a medical background to do a test. You need to have a background of doing tests. So
I'm sorry, I started on the wrong article. So this is the one you wanted. This is the one you wanted to see first.
Yeah, this is we talked about the fact that the pandemic has been much harder on the African American population than it has been on the Caucasian population. I think I mentioned last week that there's a study from Hopkins that identified that since the pandemic, suicide rates in whites have halved, cut in half, and the suicide rates in blacks have doubled. So it's much harder on our African American population and people of color than it is on the Caucasian population. And so it's important to be able to deal with the isolation of the pandemic, which in some cases is as dangerous as the pandemic itself. And so they offer some very common sense suggestions, talking about being kind and helpful, remembering that they talked about the thing that is most contributory to long life is optimism and gratitude. Exercise, once again, we're reminded how important exercise is, and it's important that everybody exercise, although the degree of exercise you can do determines in a lot of ways on your physical state, but everybody can exercise. The degree to which you can exercise is different. There are all kinds of aerobic exercises that you can do even when you're physically disabled. But still the importance of 150 minutes of exercise as a minimum becomes very important. And it's interesting how that correlates with brain cognitive function. Then proper nutrition, of course, is always there, as Darryl is quick to remind us, should we forget, and how important that balance is emphasized here, and how sugar-free, sugar-rich diets are damaging. And number four, It's interesting. I think this is where the African American community is the most disadvantaged. We survive on social connectivity, and being isolated really hurts us medically and physically and mentally. And so, and as you recall, when you talk about why churches membership is associated with longevity, one of the most important things is the social connectivity that goes along with churches, or used to go along with churches. Now that we're in isolation, we lose some of that as well. And then keep your brain activity. Let's see, John, you still doing chess?
I've been losing too many games. I quit.
You actually quit.
Sorry about
No,
that.
I haven't quit, but I lost 8 out of 10 games, so I stopped for a while.
That's not good for the ego, is it?
No, man.
Well, I guess you have to learn something new. Try checkers. That's easier.
No, chess is like the bell-shaped curve. I'll have a winning streak soon.
Hey, professional baseball players get paid $1 million for hitting it 2 out of 10 times.
Well, yeah, but yeah, of course, that's not good though. 3 out of 10 times is really, they consider that well. So I mean, it's interesting. You're right. But that's interesting. It all depends how you look at it, right? Is it 2 out of 10 or I failed 8 out of 10? It all depends on your mental state. Good point.
Yeah, I like Sudoku.
What's a good success rate for surgeons?
Well, we like 100%, man, but we just give it our best. That's all I can tell you. And of course, the patients determine whether we're doing it well enough or not. But a lot of it relates to the interaction that you have with the patients, because you can do your best job and still lose patients, and you can do your best job and not interact with patients. And if you don't interact with patients, you will have a lawsuit. If you interact properly with patients, it's unusual to have lawsuits. Then the issue that we tend not to appreciate as much, except for, of course, Myra Thorpe is now are you down to 8 hours yet, Chapman?
Yeah. I sleep 8 to 9 hours now. Yes.
You're back to normal, huh? So sleeping is thought to be one of the most important influences on longevity as well. So, and they suggest 7 to 9 hours is the proper amount of sleep that you need to have now. So these aren't very huge things that they're recommending during the pandemic, but if you're home alone in a room and you're not doing any of these things, that's harmful. Hey, it's good to see Pearline back. Welcome back, Pearline.
Thanks, Dr. Callendar. Thank you.
You had a tough time. People don't know what you went through. If you want to, you can tell them. But anyway, okay. I'll leave it up to you.
I'll tell them. Okay, I went in to have nephrectomy, which is taking out the old kidney that rejected because it wasn't working and it was causing me to have problems. And when the doctor snipped the old kidney from the aorta, the right aorta in the leg, it bled. It bled out. It was necrotic and it bled. I lost like 4 pints of blood. And they had to put me on a respirator. I stayed on the respirator for 4 days. They had to call in the vascular team to put a tube. They clipped both sides of the aorta, put a tube in so I could have blood flow to my right leg. So I'm doing better. I'm all healing real good and everything. I feel okay.
Good. Make sure you inform the transplant team what you went through, because that's a separate team that did the surgery for you from the transplant team. So be sure to let them know everything that happened there. because they're
They
not gonna know
know.
me.
They,
Okay.
they know. They came in and they saw me.
Oh, good. Okay, wonderful.
Wait a minute, transplant team?
Yeah,
Oh, at GW. Okay.
yes,
Oh,
yes,
okay. I will.
yeah, that's important.
Well, I saw the plastic surgeon. I saw him on Monday, so he knows what happened. But I will let the transplant
Yeah,
team
please,
know.
that's important. The transplant surgeon needs to know.
Okay, I will. I will.
Because they need to determine where they're gonna put in the next kidney.
Yeah.
All
Okay.
that, all that matters, very important.
Yeah, I will.
Okay.
All right. Thank you.
Pauline, which hospital was this at?
Howard
Where did you have this? Which hospital?
University.
The next article is on the face mask mistakes people make without realizing it, and it's interesting. I think some of you will be surprised at some of the simple things that we do that jeopardize the proper use of the mask, and they identify them. And you aren't washing your hands before and after you take off your mask. That's a common mistake, and people sometimes forget that. 35% of study participants reported not washing their hands before, while another 43% after they take off the mask, they didn't wash their hands. So, and then you aren't cleaning your face after wearing a mask. That's something that most of us are not doing. Did not wash their face after wearing a mask. And those who have acne, it's more of a problem. Now, I never heard of this one, but maybe some of you have. Sharing a mask with others?
Oh my.
That's just awesome.
Horrible.
I'd never heard of that, but anyway,
No.
I guess it's not common among us, but in some populations it is.
What was that? I didn't hear that.
Sharing the mask with others.
Sharing.
Yeah, that's unfamiliar to you too, huh? I had not seen anybody doing that.
Me either.
But if it says if there are multiple people living together, some people may want to do that. The other mistake is that some people are reusing disposable masks. And that is something that's easy to do because they say that the simple masks for one use only, which means you should just throw it away once you use it. And some of us may be using it again after you use it once.
Okay, just to get into a routine. Okay, you know, everybody goes to the grocery, and I typically see people leaving the grocery and ripping the mask off. But it seems like the better thing to do would be to keep the mask on till you get home, take off the mask to start it, and wash your hands.
That makes sense. What you said makes sense. What those other people are doing is incorrect.
Yeah, because I mean, your natural tendency, you take the mask off as soon as you leave the store, you get in your car. The natural tendency is you've had the mask on irritating your face, and so you're going to use your hands to touch your face. And your hand already just touched the mask to take it off, and so you could be putting germs, viruses on your face, which gets close to your nose, your mouth, and you have an inception point.
Yep.
And, your eyes too.
That's right.
Any other comments?
Yeah, at the dialysis center, they give patients a mask and then they take it off at the end of the procedure and put it into an envelope and give it to them the next time when they come back. And I told them, I said, it says disposable, and disposable means you have to throw it away. And I won't be doing that. So they know I don't do it, but they still do it to some of the patients.
Now, are these disposable masks? Because
Yeah.
Well, that's you're right. That's what disposable means.
So they're doing it, and I told them I wouldn't be doing that. Thank you very much.
Well,
Now,
I'm one of the ones that's guilty because I never thought about it. As soon as I leave the grocery store someplace and get in my car, I just rip it off. And I never thought about even that you had to wash your face or anything. I don't know, this information hasn't been getting out because this is my first time hearing it. I know they tell you not to touch your face, But sometimes, you know, if it's itching, you just unconsciously scratch your face. And as soon as I get free from whatever environment I'm in, except for the other day, past couple of days, I've been wearing a mask while I'm walking, and that's the first for me. But I'm gonna try to do better. But this type of information, I never heard about washing your face or anything like that.
The other thing is that they have a lot of those things that allow you to use to disinfect your hands. So if you're gonna take off the mask, you might do it as you leave the store and wash your hands after you take the mask off if you're gonna do that.
Yeah, I keep a bottle of hand sanitizer in the car. So as soon as I get in the car, before I touch the steering wheel, I sanitize my hands.
But is it good to use the hand sanitizer on your face?
No,
No,
not good.
no, that's just for your hands. Right. Alcohol is problematic.
Also, if you wash your hands a ton of times and use hand sanitizer, it's bad for your skin of your hands. So I have to use lotion, keep my, because the back of my hands like get real scratchy and dry.
Right. Yeah, that's very true. Now, they do have reusable masks, and that's what your dialysis center you should use. But they're supposed to be washed after a certain number of times of using them. So they're suggesting washing after each use. I'm not sure that that's necessary, but certainly you can't go indefinitely without rewashing.
Yeah, I was reading the best type of mask to use, and a search came up on KN95. I got them from Amazon, and I think it was like $30 for a box of 50. And they're disposable masks, but they're kind of formed out to give you some breathing space away from your nose, and they fit the bridge of your nose real tightly. And so they're a lot more comfortable, but a lot more effective too. So I would kind of recommend that KN95 that you can get from Amazon.
Yeah, I have a friend from Korea who sent me some, and they are very different. You're right, and much better than the conventional mask. And they're the ones that they're doing studies on. Now, this next mistake, it bothers me all the time, but I see people like this all the time. They don't cover their nose. I see that in the hospital as well. Physicians and others, nurses and others who don't realize that if you expose your nose, what's the point?
Yeah.
It's almost like you don't have a mask.
They'll still let you in the grocery if your nose is hanging out.
Which is wrong, which is unfortunate. Yeah. And of course, the practice of discarding them after you use them is a good idea to put them in a special location.
So I have a question. I've got these KN95s. I bought 4 boxes of them, and I let them dry out and use them again. But shoot, when I'm walking, especially in the cold, it's like a ton of moisture on the inside. I mean, they're almost like dripping wet on the inside. So if it's just me, can I reuse these? It doesn't say disposable. I just wonder if I can reuse them.
They are reusable. The question, though, is how many times you can use them. And I think they talk a bit about that, but they are reusable. Now, the problem with the disposable, they are meant to be disposed, as Pearline said. And so after one use, the ability of them to filter out the viruses is decreased. So the more you use them, the less efficient they are at filtering out the bacteria and viruses.
All righty.
Yeah, I thought this was a very important one to include because, as Carol said, much of that information is not well known. Now, this is an interesting point about the vaccine. And there's some who recommend you only need 1 dose. And of course, this article puts that to rest here, but it does talk about the fact that even after the first dose, you do have, after 10 days, you have positive impact. But it also mentions that the first dose gives you 52% protection, and the second dose gives you the 95%. So that you need both doses to provide the maximum protection. And so the one dose is not recommended, although we've heard in the past people mention that if you want to help more people, just give everybody one dose. But then you're compromising the efficiency of the vaccine.
I just heard yesterday, Doc, that the flu vaccine is anywhere from 30 to 60% effective.
Right.
So the one dose of Pfizer is almost as good as a flu
That's correct.
vaccine, but you might live if you get the flu again. I don't think you're gonna survive that well if you get COVID again. You know.
Well, the other thing that is before the vaccine and the medication we now have, we didn't have anything. So now we have the vaccine and medications. So we're getting close to the point where we're as effective as the flu vaccine plus everything else. So and there's another article that talks about when we will be able to get back to normal. What are your thoughts? We now have the vaccine. We now have dexamethasone. We have remdesivir. We have the antibodies that Carson and Trump got. What are your thoughts? When will we get back to normal? What would be your guess?
I'd say next fall for real.
Yeah, I'd say September if I had to guess.
Yeah.
There's a couple other things. There's a COVID nasal spray they started testing in the UK.
Yeah.
11. That's in clinical trials now.
Yeah.
They've also got an Army vaccine that they think could have high effective rate in the 90%.
Well, I think that any other guesses in terms of when you think we'll be back to normal?
I think probably by 2022 at this time.
Any other guesses?
The fall of this year.
Okay, many people think it's fall. I would think that by the summer, if everybody takes the vaccine. Now, that's the if. That's the if, because for example, even at Howard University Hospital, everybody has not taken the vaccine. So there are people who, in spite of everything, will not take the vaccine. So we're not going to be able to have herd immunity, which we need to have about 70% to take the vaccine. So if 70% took the vaccine, we could be back to normal by the summer. But it is more likely that what you said around the fall is more likely. But my guess is it could be the summer. Unfortunately, many people are resisting. Any thoughts on whether there are certain groups for which the vaccine should be mandatory?
Inmates.
Interesting. That's an interesting thought. Why the inmates? Why are we taking away their autonomy?
Well, to me, being in that closed environmental system,
Yeah, it's kind of
if somebody gets it, it could really, spread super fast. That's what I was thinking. It'd be safer for them being confined.
it's a free country, so you really can't make it mandatory for anybody.
The other
That's
thing,
true. Autonomy. That's what autonomy is all about.
They lock them up together. I mean,
yeah.
so the inmate cannot get away from that other inmate. They should make it mandatory.
Interesting thought. Interesting thought. And it's food for thought because autonomy is something that we pride ourselves on with freedom of choice. And but should it ever be abridged? That's the question. And very interesting.
I have a question, a statement. Things are made mandatory, like children cannot attend a public school without certain vaccinations.
Yeah.
If they don't have them, they cannot attend school. You cannot drive a car without a license if you get caught, or have a car without insurance. Yeah, there are a few people that get away with it, but these things are mandatory. They're mandatory that you have car insurance. Yeah, they can't make everybody do it, but they are mandatory. Because we are a free country, doesn't mean that you cannot make things mandatory. You're mandatory to pay taxes.
Yeah.
Whether or not you pay them or not, it's still mandatory. So be careful how you use the word mandatory. Yeah, they can make it mandatory for all teachers to take them. But
point and counterpoint. Great discussion. Great discussion.
Yeah.
Any other thoughts?
Well, when I'm king, everybody's going to have to get the vaccine.
Namaste.
Is your name Trump, by the way?
I'll set you free. Vote.
I'm not a crook.
except for the people in Kentucky and Appalachia. Okay. Bye.
Any other thoughts on that subject? I just introduced it because it's a topic that most people don't think about, but it's food for thought. And Carol and Darryl's points are both well taken.
What about the Jehovah Witnesses? Are they thinking about taking it, or anybody heard anything whether or not they feel they should take it?
I haven't heard anything, yay or nay.
They'll take it, but you got to knock on their door first.
That's not fair. They
That was in rare form today.
my son and my first wife are Jehovah Witnesses. They don't believe in any transfusions or any injections or anything like that. So no, the answer to
Is
that
she taking
is
the
no.
virus? Is she taking the vaccine?
As far as I know, no.
She's not going to take the vaccine.
No.
Oh, okay.
This is my first wife.
Oh, I see.
We understand why now.
Why does
Hey,
this
Carol.
So
That
won't
was
they
a
be
real form today,
designated
boy.
as super spreaders when they come back together? Won't they be designated as super spreaders?
Yeah, that's true.
Well, this is an interesting article which talks about the fact that when those people invaded the Capitol,
Yeah.
they brought the virus with them.
Right.
And because they went back into the same room and finished the vote, electoral college vote, which was heroic, they also exposed themselves to a possible coronavirus super spreader.
Right.
And so the question is, was that a deadly vote that they did? This is something that people will talk about, especially if anybody in that group not only comes down with the virus, which they have already, but if anybody has to be hospitalized or has mortality.
There was a broadcast. They showed one of the Democrats passing out masks, and the Republicans refused to put the masks on.
Yeah.
And so far, at least 4 people have contracted coronavirus. They came out positive, and 3 of them were Black.
Wow.
Or two of them were Black.
Well, it's interesting how Republicans believe the lie. That's all I can say. They believe the lie, and then they put it into practice when they vote. There was an interesting Maginot Rapinoe, the soccer player. Her protestation was that this was all about white supremacy. What do you think?
What is all about white supremacy?
Insurrection, the Capitol insurrection.
Oh, big time,
Very definitely.
big
Yeah,
time.
I agree with that. I agree.
There's no
Even
question
the
about
black,
it.
even
Being
the
a
black people that were in it, they believe in
Yeah.
it too.
Yeah.
Being a white person here, being a white person here,
That's what's interesting,
Yeah.
that the black people in it believe in it too, which is
Yeah.
interesting.
Speak up, Kevin. Speak up, Kevin.
being a white person here, I would say the insurrection is about white supremacy. Yes.
Yeah. Yeah.
Well, and it's interesting that
Participating, but I see it. Yeah, I see it in friends that I went to high school with down Southern Maryland. They're terrible.
well, it's interesting that it's almost like we got close to the Civil War again.
Yeah.
It's frightening, and that's even more frightening that the Republicans after that still voted.
Yeah.
Still
Oh,
voted for it,
yeah.
which is kind
Horrible.
of horrifying.
Mm, mm.
You know,
Oh.
When they bring nooses into the Capitol, that's just a symbolism of, back in the day. So yes, it's about white supremacy.
I agree with that also because I saw several Confederate flags
Yeah.
down there at the Capitol.
Yeah. Yeah. And also a guy wearing that Hitler's thing, something Auschwitz camp or something like that.
Yeah, it was a frightening thing to
That was
see.
frightening.
To see how people also, I was surprised that Biden actually recognized that the way they handled this was so different from how they would have handled it if it were with black people.
Yeah, that's right. He sure did.
Yeah.
But what is
I-
so amazing, everybody is astonished that senators and representatives are white supremacists. that
Yeah.
the police are white supremacists.
Oh, yeah.
There is no law that says you cannot be one. So I don't know why is everybody surprised that it's infiltrated all the way through and that like their alarm button was there. They don't understand that this is America and you can be anything you want to be. They try to make it a law against the law to be a Black Panther, but that didn't work. So, you can't make a law that you can't be a white supremacist.
Can we get on about the mask again, though?
Say again, Kevin?
Can we get back onto the subject of masks?
Yes, go ahead.
We
Was
sure
that-
can. Because don't forget, the biggest mask of them all is those Ku Klux Klan helmets that they wear.
That's right. That's right.
That's the biggest mask you ever gonna see.
Yeah. Yeah.
With this next article, I didn't realize about Alabama after they won the college championship.
Oh,
They had
my
a big
gosh.
they had a big rally.
Woo!
Had thousands of people.
Yes. Yes.
And
Thousands.
Thousands. Yes.
Yeah.
Didn't South Bend people do that when they beat Clemson too?
Yes.
Yes.
Yes. Because
Yeah.
John doesn't
Well,
want to acknowledge that.
No. Remember, I showed a picture of it.
Yes, you
Remember,
did.
I showed a picture
I
of it.
remember.
Yeah. I say 60% of the kids had the masks on, or maybe more than that. I say 75% did have the mask on, even
Yeah.
though they were not socially distanced.
Kevin, though, your point about the mask,
Definitely not.
was that the point you were looking for, or was it something else?
That was it. I thought, that the topic was more about masks.
Yeah, did you see our presentation on masks already?
Just been listening to what's been talked about today so far.
Okay, we had a presentation on masks in terms of the proper wearing of masks and all of that. Did you see that one? Because if not, that's an article that you should look at because we need to be careful about how we're wearing the mask and to be sure we're wearing it properly.
Okay,
But that's an article. If you don't have it, John can send it to you because I think everybody who wasn't on for that part of it should get that article so you can see how to properly wear the mask and when you should wash your hands and so forth and so on. And because that was a critical point that many of us were not aware of in the past.
Correct. Okay.
So John, you have his.
Yeah, he's on the list.
John
Okay.
probably sent it to me already.
Yeah, he's on
Okay.
the list. He
Okay.
gets all the articles.
Yeah.
Okay, so that's one you look at again.
Okay.
Now this is a sore point right here, as we talked about that in the beginning, because John Buchanan wasn't able to get his vaccination because of some mix-up.
Yeah.
And talked about the slow way in which it's being distributed, and the way in which every state has its own formula that it follows. And with us having 3,000 deaths a day from the coronavirus, it's important that the distribution be done in a more efficient fashion. And there are states that are doing it very well, but there are other states that are not doing it so well. And so this is something that really needs to be nationally done, perhaps. What's your thoughts on that?
Well,
I think-
there are a lot of places not like the big cities, okay, that are really spread out. Especially out in the Midwest, like Wyoming, Idaho, where the distribution of the vaccine is problematic. All we have to do is go down to the corner Safeway or to the CVS to get a vaccine. Some of these people are spread apart by hundreds of miles, so it's an issue. I mean, for us right here in DC, we really have it easy.
Yeah, I'm curious about how many vaccines can actually be produced in one day. You know, when you see one county like Montgomery County get 9,000 vaccines with a population over 1.5 million.
Yeah.
I mean, it's just, we just don't have enough, and not obviously it's not warp speed.
Yeah, I agree with you. I agree with you.
That's a good point. And I think that under Biden, I think the national distribution will be different. He talked about taking out 1 million doses out of the reserve so that the point that you're making can be addressed. Because with us having 3,000 deaths every day, we need to really ramp up the distribution rate. Now, it's interesting that, I don't know how many of you know this, there've been over, I think, 2 million doses administered. And there has been one death that was identified yesterday.
Oh my God, from vaccine?
Yep.
Well, this doctor died 16 days after the vaccination.
Oh my gosh.
Yeah, they're not sure if it was the vaccine. They're not sure that the vaccine was the cause or not.
Yeah, but anybody who dies after the vaccine, that's one of the questions they'll raise. He actually died from a blood disease, blood disorder. The only question was, did the vaccination have anything to do with the blood disorder? And we don't know that yet. So, but I just mentioned it so for completeness, so that you would be aware of the fact that out of 2 million doses, there is one person who died from a blood dyscrasia, which we don't know whether it's vaccine related or not.
Oh my gosh.
And remember, most of our studies involve 30 to 40,000 people. Of course, nothing is like this rollout where you've had 2 million people already vaccinated. So 1 in 2 million is a pretty low rate of problem. But the question is, did the vaccine have something to do with it? And so we'll get that answer shortly.
The other question that it brings up, Dr. Callendar, is how the vaccine affects other pre-existing diseases. I don't know if this doctor's disease was pre-existing or not, but it brings up the subject at least.
Yes, it does. So, and we'll know in the next week or so, we'll know the answer to that question and whether or not he had any other predisposing causes. Now this is what the answer should be. How can we speed it up? And I think the president-elect had pointed out that he's going to take it out of the reserves, because remember, there's up to 100 million doses that are available. So it's kind of almost inexcusable to have problems distributing the vaccine. But we are having those problems, as you can see. So I think over the next 2 weeks, it'll be interesting to see what steps are taken to eliminate the problem that Kevin talked about, because it's disturbing. And you see that pledge by Joe Biden, 100 million doses in his first 100 days in office. I hope so.
We got to get from 2 million to 100 million in 100 days.
Yep.
That's
Next first 100 days, yeah. We shall see. Talk is cheap.
Yeah.
Well, at least, I mean, he made his campaign promise on that, and our other president is still trying to figure out why he didn't get elected. So he ain't doing nothing for the disease.
Yeah, what do you think about the impeachment?
Wonderful.
I just don't want him to see him be able to run again.
He should be thrown out of Republican Party.
Well, I mean, if he gets impeached, I think they have that one part where he will not be able to run again in 2024 or ever.
Currently,
Right.
Las Vegas odds are that the Senate won't convict 7-2. Those are Las Vegas odds.
Well, you know, here's the difference. If they did this before the 20th, you had a Republican Senate. You do it after the 20th, you have a Democratic Senate.
Yeah, but you still need 67 senators to convict for impeachment. And right now, 7 are on board. They need another 10. It's unlikely they'll get another 10.
Well, it'd be interesting to see what happens.
2 of them coming in from Georgia.
Yeah. Yeah. I just saw an advertisement on the television just now from concerned Republicans saying that Trump needs to be convicted. It's a big full screen article on the news this morning on a commercial from concerned Republicans.
Well, they ought to be concerned. They were bending down from this insurrection. I mean, they were frightened for their lives. And who was targeted? The vice president. Pence was targeted. I mean, that's well. Anyway, we shall see. But anyway, you can see some of the ideas that they had about speeding up the vaccination, including using churches. This isn't in here, but using churches as a place to roll out the vaccine is something that should be thought of as well. And then, of course, using the National Guard, other things.
And I think, wasn't there issues about who can actually administer the vaccine, that they were making it so hard for nurses to be able to do it, that they're running short on people that actually could do it?
Well, that's fake. You're right. That's fake. What do you think about that, Berlin?
You mean, I know nurses are taking classes in order to be able to give the shots.
Okay, that's good.
Mm-hmm.
Okay.
What do they mean when they say including the National Guard on this? Are they going to be able to give shots?
No, just to
direct
not
traffic or
just
whatever.
get things in order. They don't mean that they'll be able to give shots.
And
But it'd be a national vaccine corps, which is a volunteer group to help support the logistics of not giving it, the logistics of it. Yeah.
Also, I have a something, Dr. Callendar, like, retired physicians, nurses, and those who are giving vaccinations in the, drugstores and all that. They could call them in, and start putting them to give vaccinations. They can use them.
If they need it, right. I suspect the problem is not the availability of health people, it's the availability of the logistics in terms of doing it. But your idea is a good one. Your idea is a good one.
Another big part is that that sub-zero freezers that they have to have, 70, minus 70. That's not a very common piece of equipment there.
Yeah, and that's just for the Pfizer though.
Pfizer.
For the Moderna, you don't need that.
No.
Well, the
But it's
Moderna
an
still
issue.
has to be cold.
It is an
The
issue.
The Moderna still has to be cold, but not minus 70 or
That's
minus
correct.
90,
That's
whatever.
correct.
Yeah.
That's correct.
The other
Okay.
thing is, Dr. Callendar, there should be, it may be a problem with follow-up. You know, you train all these people to give out the vaccine, but, you know, you have to follow up these patients too. So that's another element.
Well, tell me more about what you mean by that. I mean, all of us are followed up by our doctors anyway. After you get the flu vaccine, there's no follow-up except with your regular doctor. So why would it be different for the coronavirus?
Yeah, because you got 2 doses that you have to give, and you've got to check on patients. So I'm saying that the people who give the vaccine out aren't necessarily the people who are going to follow up for the side effects.
Oh, well, the sensitive side, well, you're right. But the side effects usually occur within the first 3 days. And just like the side effects with the flu vaccine, I don't think there's any real formal follow-up with the flu vaccine, nor is there one for the corona vaccine. And the reliance is on your primary care physician if you have problems to go to your primary care physician. So in many ways, there is no follow-up for the coronavirus, and that's the point you're making. And and what happens for our population, people of color tend to use the emergency room as a primary care physician, which is a mistake. Any other